Is there absent lung sliding? This is what a normal lung looks like on ultrasound. On either side, we can see the ribs with the rib shadows beneath them. Between the two ribs is the intercostal space. Here we can see the pleural line moving to and fro. This is called lung sliding. Sometimes it can be difficult to identify absent lung sliding on the B mode, particularly when the patient has poor respiratory efforts. This is when the M mode comes in handy. If you see the seashore sign, then that confirms presence of lung sliding. If you see the barcode sign, then there is absent lung sliding. Does absent lung sliding confirm a pneumothorax? No. There are many other differential diagnoses for absent lung sliding. What sign confirms a pneumothorax? If you see a lung point, that is 100% specific for pneumothorax. Therefore confirms the diagnosis. However, its sensitivity, the ability to correctly identify the presence of a pneumothorax, is much lower, around 66%. This is because in large pneumothoraces, the lungs may be so collapsed that there is no point of contact between the lung and the chest wall. Note the portion of the pleural line to the left of the arrow is sliding to and fro. However, the portion to the right of the arrow remains static. This is called a lung point and is the point of demarcation between normal lung tissue and the pneumothorax. This is the M mode view, when the cursor is placed just at the lung point. To the left of the blue line is the seashore sign indicative of normal lung sliding. To the right of the blue line is the barcode sign indicative of absent lung sliding. Check out our other PoCUS videos at the Emergency Medicine and PoCUS Geek.